Another high-profile hearing on Capitol Hill, this one on the origins of the coronavirus pandemic. At the first public hearing by the House panel investigating COVID, witnesses called by Republicans made the case that the virus may have been the result of a lab leak in Wuhan, China. We know now that 2 U.S. intelligence agencies in the Department of Energy and in the FBI have now issued low to moderate confidence level assessments that the virus was most likely the result of a lab leak. That means that they believe the evidence is largely circumstantial. But there is still no consensus among all U.S. intelligence communities. With us now, Republican Congressman Brad Wenstrup of Ohio. He's the chair of the Select Committee on the Coronavirus Pandemic. He's also a physician and an Iraq War veteran. Mr. Chairman, thanks for joining us. I first want to get your overall takeaway on what you and your committee learned in today's hearing. Is the U.S. any closer, do you think, to finding solid, definitive evidence about how and where this virus originated and spread?
Yeah, I don't know that we'll ever get exact definitive evidence, though there is no smoking gun at this point, but I think that we did make some progress today because you saw all the witnesses today and really all the members agreeing that it is important that we try to find the origins of COVID. If we are going to move forward, and hopefully this committee can produce a product as we move forward that will help us to try and predict if there's going to be another pandemic and prepare for it and maybe prevent it if possible and protect the American people. So we have to have these serious conversations. So I thought that was a good start today as we went forward in that direction. You know, there was interesting moments to it. When you talk about nature versus the lab, I think it's healthy to have the conversation about both, and we had the chance to do that today. But we've seen some curious things that came out in the testimony today. Dr. Redfield was talking about things that happened in the fall of 2019 in China, where they destroyed the sequences. They had a couple of researchers that got sick during that time. They changed over from civilian control to military control at the Wuhan Institute of Virology. And so, you know, we see some things that raise some eyebrows. They also changed their ventilation system within that lab. So, you know, those are things that make you curious. And, you know, look, I would love for this thing to be from nature. I think that'd be the safest thing for mankind, is that it came from nature. So I do want to look at that, and I hope that that's what we find. But I do have grave concerns that if it came from a lab and it was created in a lab, which we know that capability exists, we were funding this type of research over there, but if it came out of the lab and was man-made, that's a threat to us in so many ways, and I worry about nefarious behavior with anything.
So let's listen to a testimony from Robert Redfield, the former CDC director, who has long supported the lab leak hypothesis. Let's roll that tape.
This virus was immediately the most infectious virus, not the most, I think probably right behind measles, virus that we've ever seen infect man. So I immediately said, wait a second, this isn't natural. And then you go back and look at the literature and you find in 2014, this lab actually published a paper that they put the H2 receptor into humanized mice so it can infect human tissue. And then you learn that the new COVID, which came from bats, now can hardly replicate in bats.
Yeah.
So how does that happen? I don't think that answer is going to come from the scientific community. I think that answer is going to come from the intelligence community.
So Dr. Redfield said he concluded that the virus was a result of an accident. If that's proven to be the case, what do you think accountability will look like for the Chinese government?
Well, that might be tough to say, but I would hope that there'd be a worldwide response. We cannot just let this take place, and if there is accountability that needs to be placed on China, it needs to happen. The World Health Organization is an organization that is there to serve all of humankind. And if you have members of an organization that aren't there for the same purpose or not willing to cooperate, then there needs to be some repercussions in some way. But, you know, look, this virus was novel, and no one had seen anything like this before. So as we went along in America, people were making decisions, in some cases flying blindly. I don't fault anyone for that. The question is, when we found out, when we got more data, when we understood more about the virus, did we make the correct decisions too? So, but as far as the lab goes, I think it is extremely important, especially if we were conducting this type of research with them in some way or funding it in some way, even through fungible means. Look, there are scientists. Going back to 2012, there was an interview with Dr. Fauci where he said, well, I think we can learn a lot by creating these types of viruses. And if we create them, and I'm paraphrasing here, Jake,
right.
You know, if we can create these types of viruses and cure them, then maybe we can take care of any pandemic that ever comes down the road. I can see where that scientific mind would be there, but he was also asked, are you concerned about this potentially coming out of a lab and creating a pandemic? And his thought at that time was he thought the benefits outweighed the risk, and the risk of it leaking from a lab is very little. Yeah, go ahead.
So I just want to, but we're running out of time, but I want to know what you made of the testimony from Jamie Metzl, a senior fellow for The Atlantic and researcher, who testified that, in his view, the scientific community discouraged investigating the lab leak hypothesis.
Well, he said that, and so did Dr. Redfield. They both came out saying that we really should look at this coming from a lab, and we think it may have come from a lab. And they got boxed out. Dr. Redfield certainly got boxed out, and then it became this small group of scientists. They're not virologists like Dr. Redfield. They excluded Dr. Redfield, and within a week of saying this looks engineered, they came out with a paper that said definitively in their mind it came from nature. Big question on that is why. And I think it's only fair that we ask that question.
All right. Chairman and Republican Congressman Brad Wenstrup of Ohio, thanks so much for coming here. Appreciate it.
You bet. Thank you.